Members, you're all welcome. Just reminding members, please switch off all mobile electronic devices because they will interfere with the recording equipment. Apologies. Do members have any apologies? Okay, item 2 under Chair's business. I just want to refer members to page 5 of the meeting pack, which is a letter from Mrs Dobson advising that she's unable to brief the committee today on the Human Transplantation Bill, given that the bill has not yet been introduced. We are going to discuss our legislative programme further on the meeting, so we can come back to it at that point.
Chair, could I just make a wee comment, if that's okay? Further to my letter to the clerk, I've had a meeting with the Speaker's office and the bill staff yesterday, and I'm advised by them that there's one issue which needs a little more work, and I've instructed them to go back to the drafter, and they said it shouldn't take too long. So I'm still hopeful that a first reading will be within the next few weeks, and I'm grateful to yourself, Chair, and the clerk, as I would not wish to present to the committee without being able to brief fully on the specific clauses of the bill.
Okay, I appreciate that update, and we will be kept informed. Item 3, members, is the draft minutes of the meeting on Wednesday the 23rd of September. Page 7 of your meeting pack. Are members content with the minutes?
Chair, could I just raise a point? And I wasn't here last week, and I'm delighted to see that someone has raised the problems associated with the Autism Act last week. Could I ask, has that letter been sent off yet to the department?
No response.
Yeah, it has been since it was raised, but there's been no response back yet.
Right, okay, because as a member of the all-party group on autism, we had to listen to the complaints from the organisation, and there was a long list of stuff that should have been done, wasn't done. And I'm just wondering, has that all been covered in the letter to the department? Because there were so many things that should have been done and wasn't done, and as a result people are suffering.
Okay, well, what we have asked for is an update on the implementation, and I think we have to see what response comes back from there and raise some of the other issues or thrash out some more of the detail. I understand there's a motion to the Assembly on the issue as well, and I think it's scheduled for next week. So we'll be awaiting the response. We can explore the response in more detail, and if that brings up further issues, then we'll drill down on those as well.
That's very good. Thanks,
okay,
Chair.
Thank you, members. So are members then content with the minutes?
Great.
Yeah.
Thank you. Item 4 then is the Health and Social Care Control of Data Processing Bill, Departmental Evidence Session. Just advising members that departmental officials are here today to give evidence on the bill, referring members to pages 14 to 69 for the relevant papers. Also advising members that following the information session with Daniel Greenberg on the 16th of September, the evidence session with the Human Rights Commission and the discussions had by the committee, a letter was sent to the department asking for its comments on a range of issues and concerns and requesting a detailed human rights memorandum giving a full explanation of the view that the bill is compatible with Article 8 of the Human Rights Act. To date, we have not received that response. Also advising members that the Examiner of Statutory Rules has provided his report to the committee on the delegated powers contained within the bill. That can be found at page 68 of the meeting pack. So I'm seeking agreement just to forward the report to the department for its response to the Examiner's advice.
Great.
Okay, welcome today Sharon Gallagher, Director of Corporate Services at the Department, and Chris Matthews, former Head of Information Management Branch at the Department. Just advising yourselves that we want you to work through the table of issues which were raised in the written submissions and provide positions on each of the issues. We'll then pause for questions from members after each clause. So I'm going to invite, I'm not sure, Sharon, is it yourself, to brief the committee on clause 1 issue, and then we will respond accordingly.
Thank you, Madam Chair. Would you like me to make some opening remarks before we start?
If you want, yes, but I would ask that you would keep them as succinct as possible.
Okay. So thank you for the opportunity to provide further evidence in relation to the draft Health and Social Care Control of Data Processing Bill. I would say the Department has listened to the very constructive evidence that has been presented to the Committee, both orally and in writing, and is encouraged by the support given by stakeholders to this important piece of legislation which would allow controlled use of information for importantly secondary uses. The level of support from those who have campaigned to have this legislation brought forward is very reassuring and mirrors the findings of our public consultation held last year, when 94% of the 59 respondents indicated their agreement with our proposals. That said, it is quite clear that there are a number of areas upon which the Department will reflect. It might be helpful if I touch on some of these today, and I'm conscious we'll work through the detail, as you've said, Chair. Firstly, there exists a level of confusion around the purpose of the bill. The oral evidence provided by Professor McClelland and Dr Colin Harper was particularly helpful, I think, in setting out the position. From the Department's perspective, I would like to re-emphasise again today that the public interest provision at 1.1b does not stand alone. Information sharing would not be permissible solely on the basis of public interest. All uses must be connected to a medical or social care purpose, such as medical research, management of healthcare services, or provision and management of social care services. It's therefore a rather narrower provision than some comments may have suggested. The Department is currently reflecting on the drafting of the provision with a view to ensuring the intention is very clear. Similarly, we are reflecting on other parts of the bill to ensure that the definitions and phrasing reflect the policy intent and that no ambiguity can arise. The permissive nature of the bill, both in relation to the making of regulations and the establishment of a committee, has caused a level of concern also. Committee members and stakeholders have questioned why, when these elements will be an integral part of the process, they are not mandatory upon the Department. Again, the Department is reflecting on the feedback received. In written and oral evidence, the Northern Ireland Human Rights Commission raised the issue of the bill's compliance with Article 8 of the European Convention on Human Rights. Section 6 of the Northern Ireland Act 1998 states that if a provision is incompatible with any convention rights, then it is outside the legislative competence of the Assembly. I can advise that in May this year, in advance of executive clearance in the draft bill, the Attorney-General for Northern Ireland advised that the bill, as drafted, is within the legislative competence of the Northern Ireland Assembly and is therefore compatible with Article 8 of the European Convention on Human Rights. Moving forward, the Department will work closely with key stakeholders, including the Northern Ireland Human Rights Commission, to ensure provisions set out in regulations remain fully compliant. Further concerns were voiced about the governance arrangements which will be put in place around the process, for example, the make-up of the committee and also the right of an individual to opt out of having their information processed under the provisions of the bill. Views were expressed that these other elements should be included on the face of the bill. This is primarily an enabling bill, and the detail of the process will be set out in regulations. While it is right and proper that these concerns are expressed, the Department will consider them as part of the next stage of the process, the development of the regulations. I would re-emphasise that these regulations will be subject to public consultation, committee scrutiny and draft affirmative procedure in the Assembly. The Department will continue to consider the feedback received and the views of the committee as the legislative process progresses. And again, very happy to take questions and have the time to set out our position, Chair.
Okay, so at this point, we wanted to move on to Clause 1. Do you want to outline anything in relation to Clause 1, or do you just want to?
Only to say, as I advised in the opening remarks, that we have taken on board the comments thus far about it open to a level of confusion, and we are considering the drafting at this point.
Okay, thank you, Sharon. Just in relation to, because there's a number of members have indicated around this particular clause, so we would request just specific responses to what I think are fairly direct questions in terms of the detail that we're looking for. But one of the issues was during the evidence session in June with the Department, it was in relation to the Fire and Rescue Service, and it was said that the public interest is an area that it would like to invoke because the purpose of this is not improving health and social care per se. It is about the education and awareness of vulnerable people who have presented to A&E or hospital as a result of fire. So, what's the rationale for viewing that as a medical or social care issue rather than a public health issue? And also, I suppose, would you then be saying that education is one of the areas that would fall into public interest?
I think what we're saying is that the medical and social care purposes are defined, and that the public interest has to be grounded in the medical and social care purposes. So whilst we had talked about NIFRS as an example, it may be an organisation that may go down this route, but there's no expectation that if they did make an application, it would succeed. Obviously, they would need to look at other options, consent, anonymised, pseudonymised information, and it would need to be proven that it was in the interests of medical or social care.
But I'm just suggesting to you that medical. Do you think that medical and social care purposes are currently defined?
I think medical and social care purposes are defined, certainly social care purposes, in section 14. At A and B, and medical at 13.
Are you honestly saying that you believe that in the draft bill, medical and social care purposes are defined?
I believe they are, Chair.
Why then are you considering the public interest issue being developed more?
Well, what we're saying is that the way the clause is crafted potentially has given cause to confusion in terms of the use of or. The intention of that clause is that it is for the processing of prescribed information of a relevant person for medical or social care purposes in the interests of improving health or social care, or equally for prescribed information for medical or social care purposes in the public interest. There was a level of confusion that the public interest was not grounded in any other in medical and public care interest, and that's where we talked about the use for education, the use for benefits and other things. That couldn't happen.
So it's the way it was crafted.
I believe it's the way it's crafted that's caused confusion. I think the intention is very clear, and what we're looking at is the way it's crafted to
So
make
is there
sure.
a better way to craft it then?
We're currently considering that at the moment because it has caused a level of confusion, but we haven't come to a conclusion on that yet.
Okay. You'd also said that the requirement provision will only be used to address unforeseen emergency circumstances and will be by regulation. I suppose the question is then, why can't it say that clearly on the face of the bill itself, and that the final decision in our case rests with the data controller?
In that instance, about the compelling the sharing of information, that would be a regulatory process through regulations would be made, brought to the committee and then brought through the Assembly. So in those instances, the committee and the Assembly would decide that that information should be shared, and therefore it would be setting aside for medical purposes only the ability of the data controller to not share the information. But you and the Assembly would have the authority in that.
But why would it not state that clearly on the face of the bill? If we've just had a conversation about how the bill has been crafted and creating some confusion, if we're talking requirement and we're talking that it's only to be used for unforeseen emergency circumstances and by regulation, why would we not have that on the face of the bill?
I think what we're suggesting is that this being an enabling bill, there will be the detail in the regulations, and we would consult on that. So we've set out the provision for requiring in clause 2A, but the detail on that would be set out in the regulations under what circumstances that would prevail.
Is it not better to have it, in your view, on the face of the bill?
I think that the bill sets out the position in terms of this allows for requiring for the sharing of information, and I think our intention for the regulations is that the detail will come in the regulations, because there's lots of specifics in around this that we need to tease out and consult upon at the next stage.
Can I ask, I suppose, are you considering bringing forward something that may put this on the face of the bill? Or are you just satisfied with what as it currently stands?
I think to date we have been satisfied. Section 2 set out the provision for requiring or authorising the disclosure of information, of prescribed information, and the prescription then would come in the regulations. So it's not just in relation to the requiring, it's also for the authorising. We would need to set out what type of information we're talking about for the authorisation of information as well. So there's more detail to follow. But this provides the enabling provision.
Okay. In relation to consent, then what does cannot practically ask mean? Does it mean that you can't ask for consent because of the number of persons affected? Or does it mean that, does it also include where someone has refused consent or the data subject is deceased?
It could include a number of situations where the data subject's deceased, obviously, but if you're talking potentially for large numbers, tens of thousands of people, it might be impractical or extremely difficult to be able to actually gain their consent. What I would say is that in most of those situations in England, what is provided is the basic information that enables the person to be contacted to seek their consent. So it doesn't necessarily mean that all of that information would be shared without consent. It's just sufficient enough information to contact the individual to ask would they consent to their information being used for whatever the purpose may be.
But could it mean about the numbers of people affected?
It could, and I think the Cancer Registry, the evidence given there, is a good example of that, where it was set out that it was impractical to ask people at that point, at that juncture of their life, when they're going through a very difficult time, for consent.
We see, in relation to opt-out, why, I mean, this has come up and it's certainly been raised by a number of members. Why is something as critical and as fundamental as opt-out not on the face of the bill?
The opt-out provision already exists within health and social care. So the opt-out provision means that basically under data protection it exists under section 10 where somebody can opt out of having their information shared. And it also exists in relation to the provision of care either for direct or secondary uses. For example, the electronic care record where people have opted out of having their information shared. So the process is already there. All the bill will seek to do is to educate the public and the organisations better on the use of the existing provisions.
And many people honestly would know that it's already there in section 10.
Well, they can already opt out because there are already provisions within the health and social care sector to opt out. There are already leaflets and posters provided, and the Cancer Registry, being one, provides the opt-out information within their leaflets. So the information is already out there, and for the electronic care record, every home in Northern Ireland received a leaflet advising them of the electronic care record and their ability to actually opt out of the process and how they could go about that.
I think, though, we have heard with interest the level of concern about the opt-out, and whilst Chris is absolutely right, there is legal provision in terms of Section 10 of the Data Protection Act. There is an issue as we move into implementation about how we raise awareness both internally in the health and social care arena and externally to users, to service users. That's something that's been done at the minute in England in relation to care.data and the rollout there, and it's something that we would absolutely need to consider in Northern Ireland to raise awareness once again of the ability to opt out. Is that fair?
Yes, no, we have already put processes in place to educate staff within health and social care around the provisions around the processing of service user information. So we've been doing that work over the past 3 years. There's some mandatory training and there's also the requirements under data protection to be fair processing. So their staff need to know how to process information fairly. Otherwise, the ICO can come in and fine them up to, as you're probably aware, £500,000.
But given the issues created in terms of public confidence, particularly in England, around data sharing and the fundamental nature of opt-out, I remain to be convinced of the rationale for not including it on the face of the bill and having a very clear definition.
The situation in GB was very different from the provision that we're trying to bring through at the minute, is the first thing that I would say. In terms, this is an enabling bill. In terms of the regulations and the consultation at that point, we will, of course, take stakeholders' views in terms of the temperature for opt-out and what needs to happen at that point. But there is legislative provision as it stands at the minute under the Data Protection Act, and our bill is fully compliant with the Data Protection Act. So the issue is, I think, the raising of awareness and the actual practical solutions and practical interventions to make the public aware of their ability to opt out should they wish to do so.
Okay, there's a number of members under Clause 1. Fergal is next.
Thank you. Could I just ask, this is on one, of course, there's 2 points to raise. What does medical mean in the juxtaposition with social care purposes?
Medical is set out at 13A and B, and 14, and social care, sorry, at 14A and B.
In the bill.
Within the bill, page 3.
I think of all of the issues, Clause 1 is the one that has
Yes.
caused us, man. You've heard that, and I know you're looking at it. So, just to short circuit it, can you give us a flavour of what will emerge as a potential Clause 1 that will address, because you've heard all
Yes.
what we've said. I'm not saying that what we've said and what others have said to us, and you know that issues of definition and generalities have caused us some concern. So what would it look like if it was right?
I think what it would look like is that everyone would be quite clear of the intention, and that's certainly not the case at the minute. We do believe it's as a result of the phrasing rather than the intent. It is our absolute intent, the Department's absolute intent, that that A and B are linked with medical and social care purposes, and medical and social care purposes are set out very clearly in the bill, that public interest is not a standalone, that public interest is only considered in the context of medical purposes set out at 13A and B and social care purposes as set out at 14A and B, and that has created a level of confusion about leaving this very broad.
Yeah, but we're probably in danger of rehearsing the arguments again, which I'm not keen to do, because I think we should be advancing on ground here, which is why I'm asking the question. You know, yes, public interest, and in relate to all of those vague issues there. We're looking for more greater definition and greater clarity around the thing. So, have you got a draft amendment?
We're
Change?
We're certainly working with OLC in terms of considering the options. The social care purposes and medical purposes are not new definitions, though, I would say. Social care purposes is grounded in the Act, that the Enabling Act for the Department, and the medical purposes.
Isn't it? They're both in the, it's in the 2009 Act. So we've taken the general responsibilities of the Department and, as it states, the medical and social care purposes. So we've just reflected what is already defined as being the responsibilities of the Department in terms of medical and social care purposes. So if that's its responsibilities, we've just reiterated that to ensure that there's consistency in terms of people's view of the responsibilities the Department has.
Yes, but the issues here are also around medical research, and what does that mean?
Yeah.
You know, so you're not.
Yeah,
I
but
suppose I'm not hearing what I'm asking for, and I don't know if you know what it is sorry, I think you do know what I'm asking for, but I'm not hearing back what that definition would look like if it was changed in Clause 1.
and I think that's where the challenge lies in terms of fully understanding everybody's kind of viewpoints and what the definition would say.
Yeah, and you accept there's confusion?
Well, we've heard that from the evidence sessions, that people are not understanding the intention of it, in terms of that it's medical research. It's not research into the number of people for an insurance company, which is an example that's been mentioned around or mentioned to the committee on a number of occasions. That is certainly never and not intending to be the intention that it would be used for. It's medical research, which obviously needs OREC approval as well, so it needs ethical approval.
Yeah, but so, quite how to phrase this. So if you're hearing all these concerns and you accept them, what will the shape of it look like that will ameliorate or relieve those concerns?
And that's what we're currently working on with OLC, to try and come up with something that will be acceptable and clear to everybody around the purposes for which the information is being shared. Because
I think the medical purposes and social care purposes are set out as they have been in the 2009 Act.
We're not minded to change that.
That's not our focus at the minute, but clearly all the feedback we're reflecting on, what we've heard very clearly is that public interest is so wide, and how does it sit against the rest of the...
I'm just not... You see, public interest is part of it, but
Yes.
our concern is that clause in its entirety, that it's not clear. It isn't clear in its entirety.
And we'd be very keen to take on board, committee's views on how we could make that clearer. So any comments you might have, or any other stakeholders, about the clarity of that, because what the department has tried to do is stay with the definitions of medical purposes and social care purposes as is set out in existing provisions, so that we don't stray away from that, and to rephrase or recraft, if we can, the clause so that it's absolutely clear about the intention. So that's our direction of travel at the minute, but clearly we're very happy to take on board any comments or any.
Well, I suppose. I'm just conscious that we will have all heard of these concerns. You've heard of these concerns, and I'd be looking for another point to rest on, if you like, in terms of how you now define it, for us to further interrogate it, rather than re-interrogate the same issues.
And we have put this in writing to yourselves as well,
Yes.
but we haven't had any response back. I mean, we presented these issues as we saw
You're
them.
going round in circles here.
Yeah.
So,
And that's absolutely not our intention, to go around in circles, clearly. In the drafting of the bill, in considering OLC's guidance and looking at the provision in England as it stands, as I say, we've been very careful about the use of medical purposes and social care purposes, because they are grounded in the 2009 Act and set out the provision for the department, the services that the department has. So we believe that's relatively clearly defined. It was the conjunctive nature of public interest that was certainly causing confusion around that. So I'm not sure how much more clearer or what action we could take at this point, albeit we're happy to hear feedback about how we can further define medical purposes and social care purposes. This is an enabling bill, and when we move into the regulations and then into the operation, the committee would obviously consider each set of circumstances, look at what other methods can be achieved and whatever, and there will be a process to go through. So it does provide a provision which I think is sufficient for the purpose of the bill in terms of those two terms.
But when are we likely to see? Because I mean, this is a bit like struggling in the dark a bit here. But when are we likely to see your amendments?
We're currently working with OLC and others at the minute.
Is there any? I mean, because obviously we're working through our process as
Indeed.
well.
Indeed.
Is there any timescale for that?
As I say, we're currently working through with stakeholders, OLC and others at the minute, to try and understand the best approach on this. We are pretty well advanced in that work, I have to say, but I don't want to put forward any suppositions today that would not be properly considered within the department. So I think we need to reflect again on the evidence given today. However, I would say our focus has been on the phrasing and on the crafting of the clause, particularly around the use of public interest, to try and make sure that it is clearly linked to the medical and social care purposes. And we believe that medical purposes and social care purposes are clearly defined in the face of the bill at this point, but would be very happy for the committee to give us any point.
Well, we've with respect, we've done that. and we're awaiting the response. And it's a very difficult position that we find ourselves in at the minute, not knowing what you're coming forward with or when we're likely to see it in relation to our scrutiny rule.
Well, as I've said, Chair, for the purposes of the Department, the medical purposes and social care purposes are set out in the 2009 Act. So that's where we're taking that from.
Okay.
I'm glad, thank you.
Sorry, I thought you had another question
No, I'm
there.
grand, that's me.
Okay,
That point, yeah.
Rosie was next then.
Okay, it's still looking at clause 1, and it's another point where there's a bit of confusion about why it's in clause 1 where it says where you've got A and B, and it says in the interest of proven health and social care or in the public interest, and the views expressed, we had views of our own, and the private advisory committee in the Law Centre who felt that and might have been more appropriate. So maybe if your intent was to use or instead of and, if you can maybe comment on that.
I think that's certainly an area that we're looking at the moment. In terms of any recrafting of the clause, we're certainly considering the offerings that have been given thus far to see if they better align with the policy intent.
Okay. And the other question I have is, the Royal College of Psychiatrists recommended an amendment referring to the sharing of information, and quote, so long as this would not subject the relevant person to harm, unquote. You haven't responded to this, so would like to hear what your views on that would be.
Sorry, the suggestion.
No, not under
It's
118.
the sharing of information. The quote is, so long as this would not subject the relevant person to harm. So it sort of
And it was
further
a college of
explanation.
psychiatrists.
Yeah, Pete 9. Yeah, and I think in responding to that, where in issues where, or in circumstances there would be small numbers of people, that it would be a consent model that would be required as opposed to sharing of their information without their consent in many cases. The information that is being used would be, the application for the information would go through the scrutiny of whatever committee is established, and one of their determinations would be to what purpose the information has been used for, how it's been stored, and obviously consideration of any impact that it has on the individuals. Because obviously the Human Rights Act, this legislation is still Human Rights Act compliant as well as data protection. So they would be looking at that in terms of the Human Rights Act to make sure there was no detriment. And it would be up to the requester to prove that that was the case.
So, but would you be in agreement that that would be a suitable amendment?
For the bill, given that it's an enabling piece of legislation, I think that level of detail would not be appropriate at the bill stage. It may be something that would be considered within the detail of the regulations, but given that it's human rights and data protection compliant, they already exist, and therefore that requirement is already in place in statute. So therefore it would be replicating something that I think anyway already exists, but we could certainly look at it in terms of the regulations when we're doing the detail.
Given that it has been raised by the Royal College of Psychiatrists, from their perspective, they obviously feel that it's a safeguard that they would like to see.
And we'll consider, in the overall drafting, but, the view would be that probably more likely for regulations at this point in time.
Although, as Chris has said, the Data Protection Act does cover, in terms of risk and harm, releasing of information, so there is provision there. But as I say, in terms of recrafting or looking at Clause 1, we're taking on board all of the feedback and considering that, reflecting on that at present.
Okay, all right. Thank you.
Okay, I have Pam next.
Yeah, thank you, Chair. Thank you. The Data Protection Act requires all processing to be lawful, obviously. So to lawfully process confidential information, you must have the consent of the data subject or a statutory basis. So for clarity, can you tell me whether the committee can authorise the release of information if there's not a statutory basis and the data subject has refused to consent?
The statutory basis is the legislation that will provide the statutory basis on which the release of information can be permitted. The committee's role will be to scrutinise those requests for access to that information, and they can then make recommendations that that information can be shared, but it will be the data controller's decision as to whether they choose to share the information or not. The committee will make the decision as to whether it's legally within, obviously, the gifts of the bill to be able to share that information, but the data controller will have the ultimate decision as to whether they choose to or not.
Okay.
So can the committee, authorise that?
The committee
It's
considers...
just yes or no, I would have thought.
It's not just as straightforward as that. The committee can give you the authority to share the information if you choose to do so as the data controller.
I think what Pam was asking was if the committee can authorise the release of information if there's not a statutory basis and the data subject has refused to consent. Can the committee authorise that? No?
No, you couldn't
No.
authorise that.
Okay, that's fine, thank you.
Sorry.
Sorry, Pam.
Thank you for that clarity. And my other question was about concern that has been expressed about the open-ended definition of processing. Of particular concern was that it could include selling, and how could this definition be tightened up in the bill?
The processing of information, obviously, it's back to our discussion around the definition in 1 around medical and social care purposes. And the information, the committee would obviously scrutinise the request to ensure that it meets within those requirements. There has never been an intention that information can be sold. In fact, the process that we have for anonymised information within the health and social care sector at the minute, the information can't even be sold if it's anonymised. So it would have to prove medical and social care purposes, and it would have to be either for improving health and social care or, as we've talked about, the issues in terms of in the public interest related to that. But the selling of information would not be a process that would be allowed through the bill and through the regulations, and the regulations would probably make that more clear.
I think, again, we followed the GB approach in this, where the bill is the enabling bill and the regulations set out the provision in more detail. And GB, they've set out further extended the definition of processing, and we would be looking at the GB regulations and the Data Protection Act, the terms of processing, and considering what's relevant and right for the legislation in Northern Ireland when we come to the regulation stage. And again, we would consult on that, brought through the Health Committee affirmative resolution, and go through a process. So it was try and preempt putting something in the face of the bill that we needed to tease out a little bit more and have the appropriate consideration of.
Okay. Thank you.
But is there a way, sorry, just following on from that then, that that definition could be tightened up on the bill itself?
There's certainly, in terms of the regulation, it'll be quite clear what's within and what
on the
out.
bill, on the face of the bill.
It's certainly something we can look at, Chair. It's not the model that has been followed GB, and we've tried extensively to follow that model, but it's certainly something that we could look at in terms of what it says in the regulations and whether or not it would be feasible to put it into the face of the bill. So we'll take it away and look at it.
Look at it. Okay, thank you for that. And next is Alex.
Okay. Data protection is identified in Clause 1, Part 8 at the overarching section, and then in Clause 1, Part 10C mentions direct and indirect information. Does the DPA cover data derived directly and indirectly?
Yes.
Yes.
Okay.
Yes.
Okay, that's good. The next bit is...
First single answer you've got today.
Yeah, keep it going, that's good. The next question is, where social well-being is referred to in the bill, could social care be substituted for that?
Again, we've listened carefully to the concerns about the use of social wellbeing and the breadth of that. We are looking at that very carefully to see whether we can ground it totally in the 2009 Act in terms of the enabling authority for the department. So it's something that we're looking at the minute very closely.
It's not a no at the moment.
It's not a no,
Okay.
but more long-winded.
Okay, and my last one is, a level 5 offence is a low level. Do you think that that is fitting for an issue of such public importance?
I think the level 5 offence can be seen in context with this setting aside the sanctions that's in the Information Commissioner's Office. So if there's a data breach in place, clearly the sanctions that the Information Commissioner's Office can apply are much more severe. Up to £500,000, and actually we can imprison people if it's very, very serious. So that's the key kind of sanctions in relation to this. But we did want to make some provision in the bill as well.
In the bill, it's a deterrent, whereas the ICO's obviously £500,000 is significant. But there are other pieces of legislation in relation to the Fraud Act, the Bribery Act. The Regulation of Investigatory Powers, Computer Misuse Act, so things like that which can lead to 2 years in prison. So situations could arise where Computer Misuse Act, where you're taking the data and misusing it or not protecting it adequately, you could end up in up to 2 years in prison.
So they could be hitting a number away, really?
Yes.
Okay, thank you.
Thank you. George?
Thank you, Chair. Can you tell me why a bill about facilitating the lawful secondary use of information includes the possibility of, and I quote, informing individuals about their social care needs or services?
The purpose of the informing them is that the outcome of the work that's undertaken following the request for information can, for example, in research, lead to improvements in service provision. Those people then who have that condition or whatever would then obviously, you would expect that they would be able to avail of those improvements in service. So that's what that actually means. It doesn't mean that you look at the individuals to decide on an individual's care. It's where you look at the issue, you come up with hopefully an improvement, and then all of the people in that who suffer from that condition, whatever it is, actually benefit as a result of the piece of research or work that's undertaken.
Well, thanks.
Okay, moving on then to clause 2, and I'm just opening up to questions. Fergal, have indicated first, yeah.
So if it's the intention that all applications for access to identifiable information will be made to the committee proposed, why is that not on the face of the bill if it's supposed to be a stringent safeguard?
I think we have heard that loud and clear through the feedback process, and it's certainly an area we're looking at the minute.
By the way, does that mean we will see movement on, just to test you on this again?
We will absolutely see movement on it, but we have some further considerations within the department and with the WLC colleagues in terms of drafting, because clearly we want to get it right when we come back to the committee, but it's certainly something that we're looking at very, very closely. It is our absolute intent that the committee is set up, so we hear that very loud and we hear that loud and clear.
And sufficient that it'll be on the face of the bill?
It certainly is something that would merit consideration for the face of the bill.
Okay, all right.
Okay, thank you. And Kieran?
Yeah, thanks very much. Given that the bill deals with patient information, what are your views on a statutory guarantee that the committee will include people who represent patients' interests?
It has always been the intention that the committee would be made up of a broad representation, because ultimately the committee has a responsibility to ensure that the information is protected and shared. So it would be our intention at this stage that it would have representative from clients, it would have probably legal representative, medical and others.
Yes, that's a statutory guarantee that will happen.
Certainly is our intention that it would
Certainly
be.
as part of the process for developing the regulations, we'll be considering the makeup of the committee and
Yeah.
the best skills.
Absolutely. And in the Department's consultation document, the defined purpose of the committee or advisory group, as it was referred to then, was to protect the security and interests of the service user from the unauthorised use of personal data. The bill states that the purpose of the committee lies in the processing of confidential information in prescribed circumstances and subject to compliance with prescribed conditions. Has there been a shift in emphasis from protecting the interests and security of the service user to compliance with the legislation?
No, one is kind of a subset of the other. So the intention is that they protect the information, but in making sure that the information is protected, when it is used, it's ensuring that it's used lawfully and in line with the bill, and that the adequate protections are put in place. For example, IT security, it's data protection compliant, human rights compliant. So the two go hand in hand. One isn't a weakened version of the other.
So there has not been a shift. It is
No.
as it was intended. Okay. That's fair enough.
Okay, thank you. And just
Clause 2.
in terms of statutory guarantee on the Kieran's first question, he said that was the intent. Is that going to be in the regulations?
It would be our intention that the regulations would.
Well, clearly, we don't know what's in the regulations at this point. We'll consult on it and draft the policy and come to the Health Committee to take their views. But certainly it's an area that we will be looking at as part of the regulation process.
Okay, thank you for that. Okay, under clause 3, and again, Kieran had indicated.
Yeah, clause 3, code of practice. Your rationale for not making the code of practice a compliance code is that it would restrict consideration of that code only. That would imply that a compliance code has to be a standalone document. Is that your view?
No, the compliance, the code of practice is something that you provides advice and guidance to professionals on how to share and protect information, but that has to be considered in line with the detailed Data Protection Act and other pieces of legislation as well. So whilst it's a guide to help and assist, that's really what it's seen as, and that's what the legal advice would be.
Right, okay. And then, finally, do you believe that a court or tribunal should have the option of taking into account a breach of the code in any proceedings?
There has already been a case where the court took into consideration a code and said that whilst it didn't have a statutory basis, it had a lot of weight, and therefore it was considered in the evidence against the case that was being heard by the judge at that point, and he put a lot of weight behind the fact that the code was there.
Right, okay. Right, that's fair enough. Thanks.
Okay. Okay, members, just in relation to clauses 4, 5 and 6, just asking at this point, do members have any questions? Okay, I will take it by that silence, but we don't. There was a number of general questions, just by way of concluding this part. Fergal had indicated first.
Thank you very much. And this probably sprung out of evidence, I think, that we had last week, which is, I suppose, around how robustly you've consulted in relation to this, particularly the general public, because clearly there's an interest from professionals in relation to this. But when it became clear that only a small number of members of the public actually contributed to the consultation, did your department make any effort to specifically target the wider public? And, well, depending on your answer, I'll have a supplement.
You'll be aware from my opening remarks we had 59 respondents, and you're absolutely right, most of those were organisationally based, but quite a few were representative groups, and Chris and his team at the time engaged quite closely with them on a personal basis, as well as through the formal consultation process. And maybe Chris will talk you through one or two of the...
Yeah, I visited a number of key stakeholders and representative groups to discuss the bill and the 3-year strategy that the Department had for information governance, to give them, try and explain it to them, give them clarity and encourage them to actually provide feedback. And I offered to attend any forums that they had with their stakeholders, the clients that they represented. And we also, the consultation period was also slightly extended. We made it 14 weeks instead of the standard 12.
But given the level, I mean, and we've also heard that in England some 700,000 people had opted out of the process and then found, in fact, and this is to do with the nature of...
That was care.data.
But they had opted out. So we were reflecting on this, and if given that scale of opt-out potential, that would have reflected some general concern, even though it's 700 over X million, whatever, it would reflect a general public concern. So in light of that, have you considered the option of consulting more widely, up to and including advertising or whatever, telling people directly that what you propose and what their views are on this?
Well, in terms of the care.data, I recognise there was 700,000, and obviously there's a bit of scaremongering around that at the time. But from our perspective, and I think this was made by one of the people who gave evidence last week, the intention would be that there will be a robust handling strategy in the implementation, because the opt-out provision is that it exists at present, and the intention would be to strengthen the existing provisions we've made around making people aware, citizens aware, and making staff aware of the process, and giving them information where they can then opt out at that time in the process.
Sorry, is that at the earliest stage of what you were talking about earlier in terms of the care record, or is relation to the specific secondary use?
I think this is in particular.
The specific secondary use.
So how does that happen?
So earlier we talked about the provision already in the Data Protection Act, and this bill is fully compliant with the Data Protection Act, and we talked about the need for some level of engagement with the public to raise awareness, to make them clearly aware that they can opt out, that provision is there. I think some of the members had alluded to the fact that even though the provision exists at the minute, there's not the level of awareness that's needed, and that's something that needs to happen as part of the implementation process, that there's a proactive engagement both with health and social care professionals and with citizens, so that they understand their right of opt-out should they wish to invoke it.
And that's, I suppose, is from a regulatory perspective from the ICO, that's particularly important given that fair processing, and I think Dr MacDonald alluded to the fact that his consideration is at the point in which we're going to share the information.
Yes.
But he's looking at it for being fair, so we have to put the process before that in place. Otherwise, he will find that it's not fair, and the data processor or data controller will be potentially in breach of the Data Protection Act.
So you're listening to that point?
Yes,
Yes.
very
And
clearly.
action will follow on that point?
And we've already taken action within the organisations to raise understanding of the issue of using people's information and sharing people's information, and that's part of what we've been doing the past
And
week.
this might be outside because it's mechanical within the system, but is there going to be a system that if people opt out, that it isn't a tick on a piece of paper that doesn't get transferred into the computer, that this is active data, that their opt-out is a guaranteed opt-out?
Yeah, their opt-out has to be respected by the data controller. They have a responsibility to honour their opt-out if that is what they choose to do. There was a mention, I think, from one of the evidence givers last week about whatever the system would be, and about talking of privacy impact assessments and things. There won't be an individual system, because what you end up doing is creating another system full of people's information. The existing processes, because there are a range of systems, then those opt-outs will have to be honoured, either at GP or at secondary care or wherever that opt-out happens to take place, and it will be the data controller's responsibility to respect that opt-out.
But given that you followed, and I know these are two different things, you followed the legislation fairly clearly in England, it has failed at some level. You might say it wasn't the legislation, it's the process.
Yeah.
But can we be guaranteed that when we end up with this legislation refined and the process married alongside, that people's opt-out will be fundamentally honoured?
Yes, because their system is fundamentally different. They created an IT system to suck information from secondary and primary care without considering the implications of people choosing to opt out, and that system doesn't. My understanding is it doesn't have the functionality, or didn't have the functionality. This is a process, this isn't a system, so it works completely differently.
Okay, thanks for that. And now, in response to the concerns that have been reflected in relation to the time that would need to be dedicated to processing information, you said that the process across the water would strongly suggest there's no significant impact on individual data controllers. But what evidence have you had sight of that that's the case?
Chris and his team work very closely with colleagues in England in terms of the committee that makes the decisions there.
Yeah, the committee, there's a process, like a backroom process that takes a lot of the responsibilities and the understanding and the questions and queries around the process, so that when it comes to the committee, a lot of the issues have been considered, but a lot of them, the case is that a lot of the requests are very quickly weeded out of the system, and basically said that this won't be something that will be considered, because you should either go for anonymised or you should go for pseudonymised or get consent. The point that we try to always reinforce is that this is only a possibility of getting access to patient identifiable information. The chances of getting access to it, given the processes that are already in place, should be quite remote, and given what we expect the stringent considerations by the committee to be. So the number of applications is probably to be, given the proportionate number that have been in GB, we wouldn't expect there to be significant numbers that would even come forward. When we look at a pro rata that they've had over the past 12 or 13 years, they've only approved 700 cases in that whole time in England.
I think it's important to say that this happens at the minute. There's just no statutory authority for it. So data controllers in some instances are releasing the information, but as Chris quite rightly says, the funnel effect of consent, then anonymised and pseudonymised, then moving into this process, means that we expect very few applications to get thus far, and even fewer affirmative applications. So we're not expecting the floodgates to open on this.
To make sure that there's locks on.
Yeah.
Thank you very much.
Okay, thank you. Rosie?
Garmaga Caherly, can I refer to paragraph 3 of the explanatory memorandum, which includes the phrase, or achieve some other tangible benefit that might reasonably be described as a public good? And we had a lot of commentary around that it seems a very loose statement to use when referring to a bill that is supposed to provide a clear statutory framework to enable the use of identifiable information. What would your thoughts be on that comment?
I think we would probably accept that that's an area that we would need to look at, and public good does leave it quite broad. And in working through any redrafting on the bill and consulting with the committee, we will clearly be looking at the AFM to ensure that the language is as tight as it can be, and absolutely reflects the intention, the policy intention.
So you agree that that is a loose statement?
I think it's certainly an area that needs to be looked at, yes.
Oh, right, okay then, thank you.
Okay, thank you. And just again, in the AFM, the policy objective that was talked about was about minimising legal risk. And we've discussed at length the public interest is not defined at present, and it's not defined in the bill. Therefore, the bill won't really mitigate against public or the risk of legal challenge, in effect. It may minimise some of it because of the establishment of the committee. So, I suppose, what is your assessment then of just how much, say in percentage terms, would it reduce risk or challenge?
I think it's very difficult to say, and you heard the evidence of the Cancer Registry, where they've said that they're operating in a very robust regime, but they still could be liable to legal challenge. For our purposes, the bill and the underpinning regulations will set out very clear and robust mechanisms, absolutely compliant with the Data Protection Act and the Human Rights Act, which means that by the end of this process there will be a very clear and codified decision that's been made. And whilst that cannot prevent legal challenge, a successful legal challenge, I would suggest, would be
but we still haven't had. We asked for clarification on how the draft bill was compliant with the Human Rights Act. Mm-hmm. We haven't received that yet either. So it's been suggested here that it's compliant. I am not suggesting it's not, but we equally haven't had any memorandum to give us a sense that it is compliant. So a lot's been said today around that assertion that it is currently compliant, and we haven't received that.
I suppose when in the Attorney General's agreement to the
Yeah.
bill, as it moved through to the executive, prior to the executive, one of the considerations at Attorney General level is if it's compliant with the Human Rights Act. And obviously the Attorney General gave the department the view that it was within the legislative framework and was therefore compliant with the Human Rights Act.
Well, I would suggest that would be shared with the committee, as requested.
And my apologies, Chair, I advised the committee of that in my opening remarks. If that wasn't clear, then my apologies, but I think I said in May of this year we received assurance from the Attorney General in terms of that assurance, and can of course share that.
Okay, by way of conclusion then, there's a number of points. Thank you for your evidence today. I would stress the need for us as a committee to see you very much put a lot of emphasis on this is enabling legislation. We need to get a sense from yourselves directly of the amendments that are being considered or being proposed to be taken forward. We're clearly hearing today that the bill, in terms of its drafting, has created confusion. I maybe just want to raise one point for our own clarity. The issue that I raised initially in relation to the Fire and Rescue Service, where you talked about vulnerable people, it's not about improving health and social care per se, it's about the education and awareness of vulnerable people. Has that now changed? Or does that still stand? Or not?
No, it has always been for health and social care purposes.
So this is not, this doesn't stand. This quote does not stand.
They could make an application, but it doesn't mean to say that it would actually get approved to the committee for the access to the identifiable information.
No, I'm sorry, I'm not understanding what you're saying here at all. Does this stand or does it not? What you
Sorry?
said, I mean, it very clearly in black and white,
Okay.
it is about education and awareness of vulnerable people. It is not about improving health and social care per se. Does that no longer stand?
I think the language was probably clumsy there, to be honest.
Okay.
That's all I can comment on, because it absolutely is about medical and social care purposes. So just to be totally clear on that.
That's clear. Okay, look, I mean, thank you for your time. You've heard from yourselves, you've reflected on the evidence, we reflect on what we've heard today. So thank you for that.
Thank you.
Just sorry, I just had one last point before you leave, and it was Fergal's question earlier around, you put a great bit of emphasis on education and awareness, particularly in relation to opt-out, but clause 6 of the bill actually says this act will come into operation on the day after royal assent.
Yes.
So
We enact as the
so
enabling.
where does that leave the period for this education awareness around opt-out?
Yeah, but the bill is only the enabling power to then make the regulations. So then as the regulations are consulted upon and taken forward, then obviously the engagement and the open consultation in those will start to educate the public.
Okay, thank you for that. Thank you for your time today.
Thank you.
Okay, members, moving on. Obviously, we will consider the evidence that has been given today and discuss further on the 14th of October. Item 5 is the Forward Work Programme, referring members to page 71 of your meeting pack. Just asking members to note the Forward Work Programme. The committee does need to formally agree our strategic priorities for 15-16 session, suggesting members that primary legislation, ultimately the bills, would be the committee's top priority, the budget scrutiny would be the committee's second tier priority, and that the committee would review its strategic priorities in January. So can I seek agreement that primary priority is the primary legislation?
Agreed.
Budget secondary, okay, thank you. Can I, in confirming that then, suggest that there's a number of stages I want to take people through. Does the committee wish to wait then until committee stage before stage of a bill before taking oral evidence?
Yeah.
Okay, and that is an agreement, okay? And the committee does want to undertake budget scrutiny.
Yep.
So that would include scheduling monthly briefings from the department on the current financial position and briefings from the trusts on their spending decisions and the impact of their spending decisions and savings plans. The committee would also want to examine the extent to which the department has taken into account our recommendations coming from our work on the budget 15-16. Suggesting also, members, that given the context of the legislation and 2 bills in particular not have been brought forward to date in the absence of a minister, that we may want to consider selecting a third area of work as a strategic priority. I would suggest, members, that we look at a review into care standards, standards of care for older people in both nursing, residential and domiciliary care. I think particularly given the formal advice that have been given to the department around minimum standards of care, and I think the very urgent focus on a key component of transforming your care and supporting people being cared for at home, that would be an appropriate and vital piece of work for the committee.
Yeah, absolutely, Chair. Given the rally that was outside the Parliament buildings during the week, actually, and the very strong voice from people that's possibly going to be affected, and the worry that you could see in their faces how they were worried, are they going to have a home where to spend the rest of the day? So I think what you're saying is very appropriate, and we should all support it.
I think so, yeah. I agree.
Okay,
And just to add, we've got some correspondence in from independent care providers who are, well, Kieran's reflected on the statutory provision being under pressure. The private sector is also under severe pressure, sufficient that they're saying that the system could crumble from their perspective, and that's a threat to all of. One further point, and that is that in England, the NICE guidelines are now recommended 30-minute domiciliary care packages. We haven't signed up to the NICE social care proposals, and therefore another to add to the growing list of inequalities. Inequality is going to exist there, where our older people are going to get 15-minute packages, whereas across the water it'll be 30.
Okay, thank you. Yes, so members, just
Agreed.
confirming that legislation remains our key piece of work and going forward. Budget scrutiny, secondary, and our third piece that we are agreeing now formally is a review into standards of care for older people.
Agreed.
Okay, thank you. Okay, just reminding members then that there will be a visit and committee meeting at excuse me, at Altnagelvin Hospital on the 14th of October. There will be an update and a tour of the new radiotherapy unit, starting at 12:30. The formal committee meeting will start at 2. Just again, stressing to members that it's important that we at least get a quorum for the meeting, as the committee will be discussing the data processing bill, and we will be coming to an initial view on whether amendments are required at that point. Committee staff have emailed members asking them to indicate whether they will attend and whether they want to avail of the transport. For information, the bus is likely to leave here, Parliament Buildings, at 10:30. So just advising members to respond as quickly as possible so that the necessary arrangements can be made. Also, that it was agreed last week at the meeting to request the department's formal response to the Commissioner for Older People's report. I've touched on it a few minutes ago, changing the culture of care provision in the North, and it was published in November 2014. Having looked through that again, I think, and in light of our agreement today around inquiry into care provision and the importance of the Commissioner's proposals, I'm seeking agreement to schedule a briefing with the Commissioner on the 7th of October and a briefing from the Department on the 21st of October.
Right.
Agreed.
Could I just add?
Yes, Farrell.
One thing I referred earlier in our pre-meeting to a conference that I had held, and I circulated members with the outcome of that report. But could I formally table that as part of it as well?
Yeah.
It's under correspondence table.
No. It's the report that we compiled as a result of the conference that was held.
Yeah, formally table that. Yeah,
That's
okay.
next week.
The 7th of October.
Yeah, that's next week, yeah.
Yeah. And just also, members, the just a seek agreement for us to schedule a briefing then for next week on the current financial position, and members are in agreement, given our focus on budgetary scrutiny. Okay, under matters arising, there's 3 items. Asking members just to content to note.
Well, Chair,
Yes.
I think that response in relation to the request for clear indication of the timescale of the provision of the report on the 99 transforming your care, I think that is a disgraceful response. If they cannot even give us a clear indication of the timescale for a report, how on earth are we going to know how far we are along the line for 99 transforming your care recommendations? I think that's an insult.
I thought it was quite insulting
A
too.
total and absolute insult that they cannot even give us an indication of when the report will be ready, let alone tell us how progress is making in the 99 recommendations. Transforming your care, which was on the go from what, 2010, 2011?
Yep.
And they cannot even, that's a disgrace.
I mean, I think, I'm happy to reflect that, and I think we should go back to the department on it, because this isn't just something that's in the system in the last number of weeks. This is, and we should have a sense of progress on the 99 recommendations.
Yeah.
Sure.
Okay, happy to do that. Correspondence is item 7, members. There are 5 items at page 83 to 91. Your tabled pack 7.6 is the briefing document from Home Care and Dependent Living that has been referenced a few minutes ago. Mr McKenna had asked for that to be tabled. Do you want to refer to that or speak to that?
No, I think that's okay now.
Okay.
We've kind of covered
Okay.
that in that sense.
So are members content to note the remaining correspondence?
Yeah.
And any other business? Do members have any other business?
Yes.
Huh?
Yes, Chair. It was just to draw your attention to, I know you're intending to be there anyway, to the Fertility Information Day, which is being held on Saturday, this Saturday in the Long Gallery, and it's just if any of the members could make along, that I know it would be greatly appreciated. There will be some photo opportunities there with, there's about 15 stands attending all sorts of different groups involved, right down to Relate, actually, because infertility can be a very serious issue and lead to all sorts of difficulties and problems. And the information day will be held in Long Gallery from 9 a.m. to around 3 p.m. and it would be greatly appreciated if members could even pop in, even for a short time, just to say hello and maybe to speak to some of the individuals there, or even the stands as well.
Okay, thank you for that. The point's well made. Okay, date, time and place of next meeting. It's Wednesday the 7th of October, starting at 2 p.m. in room 29. Thank you.